Our lovely patient, who's 44 years old, is about 2.5 weeks out from her abdominoplasty. She had a C-section and has 2 children, and she comes in today to share with us and everyone else listening how she feels about her experience and what the entire process was like for her.
My experience has been really incredible. I had about 10 consults with different plastic surgeons around where I live and a little further out, and Dr. Claytor was the best one. He took lots of time to answer all of my questions. His staff has been really helpful and amazing. The healing process has been much better than what I was expecting, and after 2 weeks, I'm already standing up straight. So this has definitely been a great choice.
Well, thank you for all of your warm and kind comments. Let me ask you a few questions. When you were researching and trying to find that relationship with a plastic surgeon, what were some of the things that you felt were important in the provider you were looking for?
I was looking for someone who could answer all of my questions and give me, factual or studies about why they did things certain ways. I was looking for a low pressure environment. I saw a couple of surgeons who were like, if you book today, we'll give you a discount, which just felt very icky. I was looking for someone who promised realistic results, who would be honest if something I was looking for wouldn't work. And just somebody who made me feel comfortable.
Fabulous. And that's not asking too much. I think all the things that you were looking for are reasonable requests, and I appreciate you sharing that journey. Can you also share with us what were some of your fears and apprehensions moving into the actual surgery day?
I was worried about downtime. I was worried about pain. I was worried about just the significant amount of time that I would have to take for myself and, not being able to take care of my family. And then it's a big surgery. Mm-hmm. So just kind of normal apprehensions about what am I getting myself into.
Did you feel that we were able to give you the information ahead of time so that you could adequately plan for the postoperative period?
Yes. Julie was really helpful with that. My husband travels a lot, so I had lots of questions about when I was going to be able to take care of myself, and she was very patient with all of that.
And so here we are at 2.5 weeks. I generally tell patients that they should be expecting that they could be driving to the post-op appointment today. And today your husband came with you, but you've been out driving. And also that you'd be up to 50% activity. Mm-hmm. Do you feel that that's an accurate assessment?
Yeah, I feel like it's right at 50%. Anything more than that, I might be a little tired.
Yeah. Perfect.
Well,
we fully anticipate that by a month, you're back doing 100% of your regular activity.
That's great. Yeah. That's great. I'm looking forward to it.
Yeah. Can you share with us what was your experience of not having drains? And it may be hard because you didn't have drains, but how did that factor into your decision-making process?
I was open to drains, but I think that this was definitely the right decision. I've read a lot of stuff on Facebook and talked to other people, their experiences, and it sounds like having drains just really prolongs the healing process. So I'm really glad that I went drainless.
Yeah, I've been doing it this way for about 17 years and have just found that drains are a nuisance and they don't prevent problems, they actually cause them. A lot of patients would ask if this was something that you would recommend to a friend.
Absolutely. Yeah, I have a friend who has had 3 kids, C-sections, and she's considering, so definitely.
Perfect. Well, thank you for sharing all of your experiences.
Thank you.